Hello from Jonathan and from me. Welcome to the programme.
First tonight, a woman's campaign to raise awareness of Lyme disease after her life was ruined by a tick bite.
When Zara Taylor from Sudbury in Suffolk started suffering from different symptoms, she struggled to get her condition diagnosed by a GP.
Well, now she wants to warn others of the dangers and is calling on the government to develop better treatments. Now, in a moment, we'll speak to Julia Knight from Lyme Disease UK. But first, here's Russell Hookey.
Walking just a few feet is now a challenge for mum of three, Zara Taylor from Sudbury in Suffolk. The 37-year-old previously enjoyed running and boxing until she became seriously ill with many different symptoms.
I was just running and I completely just fell over out of the blue, and from then onwards everything started to deteriorate. I started to lose the use of my bowels, my bladder. I had slurred speech. I had like really bad flu-like symptoms, couldn't even get out of bed. My legs, my arms, they ached. I had really bad brain fog.
A rash on her arm and torso was put down to ringworm, but it's likely Zara was already in the early stages of Lyme disease, caused by a tick bite. As it progressed, the consequences were devastating.
It's robbed me of the last 4 years of my life, because I'm a mum of three. I can't do anything that I used to be able to do.
Despite the debilitating effect of the illness, Zara struggled to get GPs to take her seriously. Her mum and dad even cashed in their savings to pay for treatment privately.
I think it's been pretty poor, actually. She's an intelligent woman. She knows her own body, and I felt that there should have been more done in the beginning to help her situation.
The family now want to warn other people about the dangers of Lyme disease and have put signs up all around their land, particularly in areas like this footpath where there's long grass. They say they don't want to frighten people who come out into the countryside, but they do want to alert them to the precautions they can take.
I just want people to be aware and to know the risks, and when they go out on long grass, wear socks, wellies or trainers. Don't go with open-toed shoes because the nymph ticks are so small.
Not all ticks carry Lyme disease, but if you're bitten by one, it's important to remove it intact, preferably using a special tool. If you develop symptoms after being bitten, it's important to seek medical attention. Zara and Angela now use social media to talk to others who have symptoms of Lyme disease. They say they want the government to take the issue more seriously and develop a vaccine or better treatment to prevent more lives being ruined. Russell Hookey, ITV News, Sudbury in Suffolk.
Well, it's one of those diseases which certainly needs more understanding, isn't it? So let's speak to Julia Knight from the charity Lyme Disease UK, who actually contracted the disease herself in Thetford. Hello, Julia. Public Health England have told us that it is a rare disease, around 3,000 cases a year, which can be treated with antibiotics. Do you think that that is taking it seriously enough?
I think what is probably going wrong is that it needs to be diagnosed very quickly. There's a very small window to start treatment in to be effective, and people are missing this window because of lack of awareness that they've been bitten, or even the health professionals' lack of awareness. They miss that window and then they can become very debilitated and very ill.
So let's raise that awareness now then. Tell us the symptoms that we should all be looking out for.
Okay, so initially after a tick bite, you would, some people get a rash around the bite area, which can resemble a bullseye, but it can, they can be atypical rashes, so that can throw the GP off. If you don't get a rash, a lot of people don't get the rash, I didn't. You should be looking out for a flu-like illness, particularly at a time when you wouldn't expect to have flu. So achy, stiff neck, headache, very unwell feeling, maybe stiff, sore joints. All those things together could indicate Lyme disease.
Right, and then you would go straight to your doctor, who would hopefully pick up on it. Of course, prevention is better than a cure. How can we best avoid contracting it at all?
The first thing to do is be aware. be aware if you're out and about in the countryside, but also be aware that they have been found in urban parks and gardens. Protect yourself with a good repellent, like you would if you were going somewhere with mosquitoes. Long trousers, avoid long grass if possible. Check yourself afterwards. Wear light coloured clothing because you can spot them easier. The important thing is being aware. If you know you've been in such an environment, check yourself straight away, you know, when you get home that evening, and particularly check your children.
All good advice, Julia. We'll have to leave it there. Thank you very much for your time today.
You're welcome.